From abortion to the January 6 Capitol riots to the coronavirus pandemic, more people than ever are seeking and being treated for mental health issues. Nationwide, 1 in 25. The problem now, getting those people the care they need. In-depth reporter Christiana Ford explains how a worker shortage is making that more challenging.
It's been a little over a month since Tyron Price walked across the stage with his master's in social work.
And I just remember looking at myself like, wow.
And he is already diving into his career as a mental health clinician with the Trauma Informed Counseling Center in Lexington.
Was it hard to find work, or did it come pretty fast?
I was definitely needed in any capacity, especially in Lexington.
The federal government keeps track of health professional shortage areas and estimates at least 166 practitioners are needed in Kentucky right now.
There's so much turnover right now among mental health professionals because many of us feel burnt out.
Dr. Candace Hargans is an associate professor in the counseling psychology program at the University of Kentucky. She is trying to change that.
I'm always recruiting. I'm always thinking about how do I diversify our field.
So is the CEO of the Bridge Behavioral Health System, Nina Eisner.
The baby boomers are growing up and we need to have enough care and treatment.
Dr. Hargan says efforts to recruit are in dire mode because that shortage is impacting access to care.
That's what you're seeing when it's hard to get in, when there are waiting lists that are 8 weeks out sometimes. You're seeing that not just inpatient, but outpatient.
And Eisner says the need for care has also increased over the past few years, and the consequences for untreated mental health can be deadly.
Being able to address these problems in a timely way, in other words, the time to act is now, is a critical element.
When wait lists are long or they get turned away from residential treatment, when people don't have access or nowhere to go, they turn to emergency rooms.
All across the state, and certainly here in this community.
Eisner says admissions to ERs for mental health crises have increased by 24%.
And most emergency rooms don't have a secure psychiatric room, if you will, to keep patients safe while they're waiting.
A large part of these mental health leaders' work is getting creative with who can help solve the issue. Dr. Hargans is leading the Neighborhood Healers Project, using community members to bring greater information and mental health access to Black Lexingtonians.
I was like, we have some really great people here who could be the pathway or the link to adequate and even exceptional mental health in our community.
There are around 44,000 Black people in Lexington. Dr. Hargan says only 7%, less than 4,000 people, have sought mental health service. The 20 neighborhood healers have been working since March 24th and have already spoken with over 400 Black community members about mental health.
As one Black psychologist, there's no way I would have that reach. They already are actively involved in their communities.
While they wait for more people to enter the field like Tyron.
If I could really just, help one teen at a time, then it really would mean something to me. That's something that just always motivated me since I was a kid.
The industry is banking on others to also find that motivation. Christiana Ford, Evening Edition.